class. Like I came across some students who, were fresh graduates, some who were there in the field for past many years, with vast experience, and some of them who were going through different phases of their lives. Some of them were getting married, some of them were having kids, some of them were, having a newborn baby with them, some of them with older kids and their challenges. And one of my students, she was appearing in French. So she used to study with me, and then, she used to translate. So, this entire experience of teaching these, I won't say students, but fellow colleagues, because during that process, I also learned a lot from them. It also changed my perspective, and it gave me a lot of information because, when you're dealing with such a diverse group, that is the beauty, that you learn a lot along the way. So, four of them, they were available today, and I'm really grateful to them for joining us, as it's a weekend, and there are family commitments and everything. But thank you, Fira, Hala, Zahra, and Sana, for joining us today. So I'll be quickly taking, like, I won't take a lot of the time today. It will be you who'll be talking much. So I'll just quickly go, ahead with today's objectives. So you will be gaining insights from my recent students, that how, what were the tips and tricks and what worked for them in the exam, how were they able to, achieve a good score, how did they perform under pressure. So they will be sharing all that with you. And after that, we will have a question and answer session in the end. You can ask those questions to any of the participants, like any of the panelists who are here today with me. You can ask me or them. It's your choice. So I won't be talking about me today. That, I think I will save that for another day. And those who are my students, they already know me, and the way I teach. So I'll be moving forward. So a quick review of what NAC is. So as we all know, that it's National Assessment Collaboration Exam, and that means that entire Canada is appearing on the same day. So all of you will be appearing on the same day. So your performance on that day matters a lot, because everybody who's going after and, before you, they will be dealing with the same set of questions. So if you are well prepared, if you have a good grip on the knowledge, if you know how to talk to the patient and how to connect with patient on, like, so many levels, not just your clinical knowledge, but your clinical manner as well, your soft skills as well, your communication skills as well, that will really make a difference in your marks. So, it's an exam which is for IMGs, international medical graduates. And why, why is it conducted? Because it just assesses our readiness to enter the Canadian system. Being an IMG, we all know that we are not trained very well back home on the ethical part or the empathetic part. Our clinical knowledge is very strong, but when it comes to the soft skills, or communication skills, we do lack a little bit here and there. So this exam is basically focused on those things. It's not a test of your diagnostic skills. I keep on telling my students that, for that purpose, QE1 is there, but it is more of a test of your soft skills and the way you will deal professionally with your patients. So you are evaluated on clinical decision making, communication skills, and patient interaction skills. These are some of the areas where NAC tests you. Then what to expect? So typically 10 to 12 OSCE stations are there, usually 12 stations, not 10 to 12. 12 stations are there. 10 was initially the case when they used to have rest stations, but now they have 12 stations. Two of them are pilot stations, and you don't know which those two stations are. Each minute has a prompt, and you get 2 minutes outside the door, and inside the room you can have 11-minute scenario, or you can have an 8-minute scenario followed by a post encounter. So this is a rough, template by which NAC OSCE works. Now, when it comes to evaluation and course approach, so how are you evaluated during NAC OSCE? So there are different levels at which you are evaluated. Three domains basically. So assessment and diagnosis, it holds 70% of your total station. Management part includes 15% because it is your post encounter usually that comes in the management. So 15%. And then your communication skills hold another 15%. Usually, with the when it comes to like I always tell my students, then when it comes to assessment and diagnosis, all of you, all the IMGs who are here today or who are in my sessions, or overall whoever is preparing for this exam, they are already very well equipped with their clinical knowledge. So assessment and diagnosis, everybody is going to score really high on that. The part where you will make a difference would be your management and your communication skills. Those are, although they don't have a very big weightage on the exam, but these two things are, these two domains are the domains which will make a difference when it comes to your exams. So a lot of experience is required because under pressure in those 8 or 11 minutes, whatever you have to produce, that will make a huge difference to your marks. So performance is expected at the level of a first year Canadian resident. So usually you are tested on that level, or you can say at the level of a family medicine practitioner. So there are 8 key elements for case handling. You are tested on those bases: your initial approach, empathy, the rapport building, then your history taking, are you identifying the risk factors or not? Then physical examination is a part of your examine if of your station. Then management and counseling part. So like in between these areas, you are being tested on ethical scenarios as well. There will be an ethical part, communication and clarity, and time management, of course, is very important. Because this is how you can succeed if you are able to complete everything in time. So like whenever we are practicing in our course, and my students are here and they can elaborate more on that, that we always focus on the mnemonics. We try to complete our histories in time. So initially I used to tell them in the initial phase of our course that just focus on the questions, learn your questions really well, so that in exam, if you are stuck somewhere, automatically you can reproduce that question and ask what is going on. And once you have mastered that technique, then you can always work on your time management. We had like live classes in which I used to give them one-to-one feedback as well, and it was a collaborative learning experience, because as I told you that I had a very diverse class. Like a few batches that I taught, they were very diverse. So now moving forward, this is the NAC OSCE. So we have, these are 8 key elements for success, as I have mentioned earlier as well. So initial approach, history taking, risk factors, medical history, etc. All of this would be, these are the areas where you are being tested. So before we move to this section, I would like to, give a chance to my panelists and my very dear students who are very dear to me, dear to my heart. So Afira was very kind because she had a family commitment, but she squeezed in some time. So Afira, please, if you can go ahead first so that I can let you go if you need to. And since all of you are really expert in time management now, so I'll be giving 10 minutes to each of you. So if whatever you have to share about tips and tricks, what worked for you during the exam, what exam looks like, so anything that you would like to share, please go ahead. Thank you.
Thank you, Dr. Sana. And I think it's so nice that after passing the exam, seeing you and, in this class is really nice. I'm feeling really great. So it's really nice seeing you. And thank you so much. I would like to thank you from this platform that you helped me a lot. Your course helped me a lot. And then the way you used to tell us our weaknesses, we worked on that. That made a difference, and the approaches. So as you said, that the initial approach set you for the success. So that was the key. And obviously your practice. So thank you so much for everything. And I would like to say that you're very professional, your course is very organized, and you are, ready to help whenever we ask for it. So these were a few things I would like to appreciate. So thank you so much. And so a few tips from me, from my experience, I would like to share. I would like to quickly wrap up in 10 minutes. So as you said that this is not the exam for, knowledge. We all are immigrants and our knowledge are pretty much great, but they want to see our communication skills, interpersonal skills, fluency in the language, and they want to see if you are a safe doctor. So these are a few things we need to keep in our mind. And I feel I want to talk about step by step, like the new people who are just starting. When you start, just first, your mindset means a lot, makes a big difference. So start with a mindset, believe in yourself. We all immigrants, we our knowledge is pretty much great, and we are not less than anyone in this Canadian system. So believe in yourself. If I can do, I can pass this exam with work and with my family commitments, anyone can do that. So, and then select a course. I would say Dr. Sana's course is pretty much enough. Don't thin yourself with too many things. I feel you don't need a lot of information. You just need to practice on, and work on your weaknesses and, polish your strengths. So, select one course, and then find few study partners. It is very important, and that will make a big difference. So you need to practice. Practice will make you, and make you the best. But practice actually help us to remember, as Dr. Sana said, the all the questions, because this is very high pace exam. We have to perform under a lot of stress on that day. So just practice in that time frame with your study partners. That is very important. Keeping calm, and this is a game of, I say, nerves, because on that day you have to perform well under a lot of stress. So you have to train yourself in that way. And time is a key. So practice within those minutes, as Dr. Sana will be teaching you that. So everything you have to perform like you're performing on that day. And one thing I've learned that when you enter in that door, when you knock that door, before that you have to be mentally ready. So you said that you can take 2 minutes to read the question, but there are few questions, they are longer than usual, so we can take more than 2 minutes. And be flexible and be open, because rather than entering into the room with some question marks in your mind, it's better to spend few extra seconds and read uh, you know uh, the question well, and then enter the room. And I feel that Dr. Sana, told us that it's okay to go back and read the question, because you're working under pressure that day. So these are some questions were very lengthy. So I took some time to go back and check the, question, because there were a few things I wasn't sure. So that helped me a lot. So be confident in going back and checking your question again. Or if you're lost, feel free to ask for, one few seconds and gather everything again. I did that, and Dr. Sana, its credit goes to you, because you told us that. Because again, that this exam is very high pace, you have to work under pressure, so these things happen. So be flexible and be open to go back and forth. um, and as I say, initial approach set you for the success. So when you enter in the room, greet professionally and start your conversation confidently, and that will help you. And at the end, be open minded. There can be things other than what you are thinking. So when you go inside, go with an open mind. and be flexible with the diagnosis and management, and yeah, work on your time. These are few things I have written. Yes, and before the day of exam, I would suggest that plan accordingly. Go if your center is you have to take a flight or something. Go 1 or 2 days ahead of the time. Go and check your center. Familiarize yourself with the environment, because that will help you to feel comfortable on that day, because there are people who know more, but because they are not calm, or so they struggle that day. So your mental strength is very important, so work on that as well. Yeah, that's pretty much from me, and I think I would say that we don't need a lot of courses. One course is enough. Good study partners, and at the end, do take mocks. That is really helpful, because they will train you to get the feel of your exam. And if you can get some in-person mock, that is great, but if you cannot, that virtual mocks are fine too. And I found Dr. Sana's mock pretty much very helpful. And there are some videos Dr. Sana have on the YouTube. They are very good. So you need to and go back and forth, watch those videos couple of times. And one more thing, that when you take one class with Dr. Sana, try to go through all of the notes and practice that. Like, for example, you are doing gastro, so do practice it with your study partner then and there, because later you won't get time to repeat many things. So that is, I think, can help you. So yeah, thank you so much once again, Dr. Sana, for being very helpful, and for making a difference, because we are from different backgrounds, we have different challenges. But I think your sincere help and your sincere support mean a lot to us. Thank you so much.
Thank you so much, Zafira. You were being so generous, and I'm really grateful. And you completed it in 8 minutes. So you can see how well your time management has been since NAC.
No,
Okay.
yeah, it is. And it's all because of the practice and, together. So thank you so much.
No, I totally agree with you that good study partners and having a lot of practice, that really helps. So find some study partners and practice every day. Yes, Zahra, you have something to say?
No, I want just read this next one, if
Yes, you
it's
are the next
possible,
one.
because uh,
Yes, you are the next one actually. So yes, so Zahra was with me in the crash course, and that I did before the exam. So Zahra, I would like to hear from you as well. What was your exam experience and tips and tricks? So please go ahead.
yeah, thank you. I really want say a big thank you to you. It was really helpful, your crash course for me. Actually, I learned a lot from your crash course. In only 1 month, I can see my improvement after your crash course, because the beginning of the crash course I was like totally my approach, everything was totally different. But the end of this like 8th session, I could see my how I improve. I could see my improvement in everything, even in communication skills, in how I can approach the patient, and you had a lot of new cases. That was really good, but because by the exam time we almost have some new cases, and we are not mentally prepared for that cases. So your course helped me, because on that time I can just approach the cases without any thinking before that. That was really helpful for me. Actually, for me, I couldn't find like one study partner that I can practice every day. Because of that, I took your courses, and it was really helpful. During that 4 hours, we could practice almost 2-3 cases per session. So it was like kind of a study partner for me. And you send your feedback was really good. I really appreciate your feedback as well. It was really good. And I personally, what I just experienced and it helped me, I think if we can just write our approach for different cases on the like a piece of paper before the exam. So you can just make your algos for yourself for your different cases. So by the time of the exam, for example, like 1 week before the exam, you can just review that case, review that algos you made for yourself. It helps me a lot. And as we see in the exam, the old cases was too longer than that what I expected for the exam. So I was a little bit surprised and confused at that time. As the dear friend told us, we can just spend a few more seconds before going to the like station, and we can just think about a little bit more. Be prepared. Don't be in rush, because all of this stress, like we think we can't do it this case because we don't have any idea about case. Most of the chief complaint was hidden, so you don't have any idea. Because for example, for one cases I prepared for myself for one thing, it was like completely different for that station. So when I went to the station, I was like surprised, because I was like completely wrong. But if you have your algos, your structure, you can just follow your whatever comes to your mind, and just take some time to the patient, to patient ask you some question. If you be like patient, and you can just answer the question of the patient, it comes to like conversation type. It doesn't mean like you need to follow the algo, you need to follow the step. It doesn't mean like that, because under the pressure, even we can remember the old step that we already prepared. Just try to be like, be your the patient is your really actual patient in your clinic, and you just try to have some conversation. I think that part helps me a lot, because after the exam I was like, I wasn't sure my score is gonna be superior score, because I missed some point of the interview that it was really important. And after exam I just remember, oh, I missed that part, or I missed this part. So but I think that that point that helped me a lot. Because of that, I just have conversation with patient. It wasn't only algo basis.
Yeah.
Yes. Again, thank you a lot for your courses, your crash courses. I definitely advise to everyone to have your crash courses, because in the last months you need to practice something that you are not prepared for. That it's yeah, it's really it was really helpful for me.
Yeah, that's very right, Zahra, and thank you for sharing that, and thank you for being so generous. You guys are being so generous today. That is very right, because in the exam, you don't have time to repeat your algos, and you cannot follow all the steps, because sometimes the questions that are thrown at you by the patient, you are not prepared for them. So you are expecting something else because of your practice sessions, but their template is and script is different, so they just ask you something else out of the blue. So if you're stuck somewhere and still you have at the back of your mind, you know your algorithm and you know your questions, at least it will take you somewhere. So Zara is very right in pointing this thing out, that make it like a communication, a two-way communication, not just a simple lecture from you, but talk to the patient in a way you will do in the real life. And thank you for sharing all that, and thank you for taking out the time, Zara. And congratulations once again on the wonderful score. And I was really happy when you shared your result with me. So thank you so much for that.
Thank you
Okay.
again. I definitely just recommend everyone take your crash course for the last month. It's like magic.
Thank you so much. Thank you.
Thank you.
Okay, so now I have one more a panelist with me, Khala. If you can go ahead now, if you're still there. Yeah, Khala is still there. So, Khala, please, if you can
Hello,
share your exam experience.
hello. Good afternoon, everybody, and good to see you, Dr. Sana, after long.
Just, yeah, I was missing
Yes,
you guys, kind of. Yeah.
yeah. Regarding the course, first of all, Dr. Sana, I did text you, but in person, I would like to thank you a lot because I had taken your crash course. I wish I had taken your complete course too, but it was like very late when but your crash course really helped me. I wasn't very active in that crash course too because of my family reasons, as you know. But still, even listening to you and going through the notes you provided, that really, really helped. I must say that when in the last days when I was before the exams, I was going through your notes and the important things that were there that really helped me. I was I was like not I was very worried for my exam because I was allotted Toronto, the notorious station, and I always pray that if I'm in the Toronto, please God, just give me the pass score. But thank God I scored really well unexpectedly. But I think the one of the reason was you, Dr. Sana. Your the crash course, the notes you provided, I went through all those the last few days, and they were really, really helpful. Regarding the NAC, as everybody has told, that you have to be very systematic in this. You have to make, since the newcomers, they have like 2 3 months now, they must, as Dr. Zara mentioned, that you have to an algorithm. One thing that I practice and really helped me was you have to make a template in the very start, in which, like, for initially you might need to like write them, but you since when you practice for like 2 3 months regarding that template, it will become your natural habit, and in the exam you don't have to write everything. It will come naturally to you, and be very natural when you appear in that. Like, at the most of the stations when I went there, I wasn't looking at my notebook. I was just conversating with the patients, and I even didn't look at the most of the examiners, like how did they look or what they were doing. I was so involved with the patients, and the patients. The main thing is you have to satisfy the patient as you have to do in like real life. So that happened. I came across two patients that were very like I've learned through other people that some patients are aggressive, and I do come across two patients that were very furious. And the main point first, initially, like, I calmed them down, as I had learned from you guys. You have to calm down, you have to convey your message, you have to listen to them. And you said, as you said, that it's a two-way conversation. You don't have to bombard the information to the patient, you have to listen to them. Yes, and that did help a lot. And regarding like if I look back, and actually I started studying in January, and I haven't known about the format or the material regarding NAC. But if I look back, and what changes I have taken in my study, to that must be one thing is like I must have taken your full course and got to practice with you earlier. And yes, the practice is the main key. You have to find your study partners. I was not very much lucky because I have a toddler and I cannot study through the day. I have to study after 10 p.m. Eastern time, and nobody was available at that time to study with me. So most of the time I was using AI to practice my counseling sessions, and I think that counseling session did help me regarding the AI. But for the examination scenarios and other, you must need you must need a study partner. So and it's very difficult to find a study partner. So I think that's my observation. So you must like the new candidates, I must encourage them to find their study partners and practice with them a lot, because practice is the key. It should come, like I believe in the exam, it should come naturally to you. I think other than that, I don't think so. Like everybody has the knowledge, and most of the people who appear in NAC have covered their passed their QE1, and they have amp knowledge. But practice is the key in this, and you have to be very much. One must say, like culturally safe. You have to be very culturally safe in this exam. You have to listen to them. You have to empathize with them. As I come from a South Asian where the empathy is not that much practiced, but here the empathy is the key. If you are not empathetic and you are very much like robotic, I don't think so. You are getting good marks.
Yeah. Yeah,
Yes.
because this is something that we are being tested on because we never learn it.
Yes.
Yeah, we don't know how to express empathy and to what extent to express that empathy. So very rightly said.
Yes, and regarding Dr. Sana will tell you, like because of the new norms over here, like the LGBTQ things, and you have to be sensible and safe regarding that scenario too. Dr. Sana will tell you about that in a very good way, and I think you should start practicing as soon as possible. And practice is the key. This is my take home message.
Thank you so much, Paula, and for sharing that. And I know, your toddler was, she used to be around, and a lot of times you couldn't, practice in the sessions. But because of, the toddler being around. But I have been through the same journey, so I know the struggles, and I'm really proud of you. So thank
Thank
you
you.
once again for taking out the time. I know it's a weekend, but thank
Mhm.
you so much for sharing your exam experience.
I just received a
And
peekaboo before
yes,
starting
please.
conversation with you.
Yes, yeah. Yeah. So, Paula, anything else that you would like to add?
And yes, one more thing, like mock, I gave mock to you, and that gave me a lot of confidence before appearing in the exam. I appeared in the mock, I think 2 to 3 weeks before my exam, so that I
Yeah.
do have like some time to cover up my deficiencies, and it did help me a lot. I think everybody should appear in the box, and your like feedback was very honest and very helpful. Thank you once again, Dr. Sana.
You're most welcome, my dear. Thank you for taking out the time once again. And now we have our last panelist, Dr. Sana, and she's very dear to me because she shares the same name as me. So, I'm being a bit biased. So Sana was with me in my main course as well as in my NAC crash course. So I would like to hear from you as well, Sana. What was your exam experience? And her station, I think your station was also in Toronto. So in fact, many of my students were there, and all of them were able to achieve really good marks. I'm really proud of you for tackling that station. So please, Sana, go ahead.
Thank you so much, Dr. Sana. It feels very odd saying Dr. Sana again and again. So, I would first of all like to thank Dr. Sana for inviting me and letting me talk and share my experience with everybody. And I'll start with a couple of things is that whoever is taking the course now or whoever is interested in taking the course, I would highly suggest start now itself because you are going to go appear in September. So you have plenty of time to gain good knowledge from Dr. Sana and do this exam. It's not a hard exam. I know that people scare everybody saying that, oh, it's a very hard exam and it's very hard to achieve good marks. So coming from a person who's scored above 600, I'm telling you that it's not a hard exam. If you follow Dr. Sana's instructions and go through the course, and see where you're, and I would suggest participating in class and asking those questions. So I was one of the students who used to ask a lot of questions from Dr. Sana and Hope, and she was very kind enough to answer all the questions. So I would suggest ask your questions there and then, whatever doubts you have, whatever you want to ask, and whatever you're lacking, that will help you. And go through the course like you're going through the real exam. So my approach always to Dr. Sana's course was that it was very precise, and there were a lot of things that I learned from there that did end up coming in the exam as well. So I would suggest that when you practice with Dr. Sana, please, whoever is attending the course now and whoever is planning to attend the course, is that uh, practice in a way that you are in the real exam. So when you do that approach, you get that approach, you practice how you're practicing in the real exam, it will help you going towards the exam. And one of the key things that I did before the exam was that I took Dr. Sana's advice. I didn't rush myself. I didn't do anything that I would feel like I shouldn't be doing. I stopped all the studies one day prior to the exam and went with a cool mind. I composed myself. So you do have 12 stations. Two of those, as Dr. Sana explained, are going to be just the pilot stations, and those don't go towards counting for your NAC. So when you go before the station, read the stem very carefully, because that stem will help you direct your questions. And yes, I did write on the book, but I never opened the book, because when you're sitting in front of the patient, what they're trying to look is that you are having an actual conversation with an actual patient. Though we all know that we're playing as role models, please don't get confused. Go there, and once you have practiced enough, you will know the steps by heart. You won't need to go read the book. Even if you have to read the book, again, it's not a bad thing, but make eye contact with the patient. And the most important question that stuck with me, with Dr. Sana had told us multiple times over and over again, was ask the patient's mood. That is the most important question. Ask the patient. And what Dr. Sana used to tell us is the golden question is ask what happened before the complaint. So that's very important. So a couple of things that came there were something that patient had a misconcept about. So once we ask the question, we are going to get the, if you ask this question before that, what happened when this complaint started, you are going to get the station right away. So it's a very straightforward exam. The patients are very cooperative, very nice. I was in Toronto. People scared me a lot, saying, "Oh, you won't score much because the examiners are very bad. You won't score much," but that's not correct. If you have gone through the course and you know what you're doing, it should be easy. It should go through a flow. You won't have any troubles in the world. And one more thing that you need to remember is that, as Dr. Sana told us again and again, that they're not like, let's suppose you have a diagnosis and you're not able to approach it right away, give differentials. Let the examiner know that, yes, you have these things in mind. Go through the list, you have these things in mind. And then there was one station where there was a certain diagnosis, and then when you got the results from the examiner, the diagnosis was towards the same thing but not exactly the same thing. So don't get confused. We all have gone through the medical school. We have all done very well in that. That's how we have become doctors. So don't stress yourself. Like, just listen to the patient, ask the right questions, and you should be good. There shouldn't be a problem, because you already know the knowledge, and you're already getting practice from Dr. Sana, and you're already going through the whole process. You should be fine. If you're stressed, you won't do well. Just remember that, like, just pretend like you're in the clinic sitting with your own patient, like you have been sitting, practicing in your medical school, or maybe sitting in clinics. It's the same thing. So I would suggest just go with an open mind, sit with the patient, talk to the patient, make eye contact. And when the patient says he's in pain, ask about how his mood is. That's the most important question. Whenever I used to ask the mood question, the examiner used to start writing in the book. So that's how I know that they were very focused on what the patient, like what questions you were asking with the patient. So yes, diagnosis is a part of the assessment, but how you're talking to the patient, how your body language is, how you're dressed, how you're making eye contact with the patient is a big part of it as well. So again, I would like to thank Dr. Sana for really pulling us through this. I took both the courses. I took the crash course as well, and I took the normal course as well. The normal course made me think in a process where I had to put things in place, and it did make me practice a lot. And the crash course just pushed me further to get a bit of a higher score than I was expecting to get. So I would again like to thank Dr. Sana for giving this opportunity to share my experience with you guys.
Thank you everyone for being so generous. And I can see that all four of you have really mastered your time management skills. You are completing in like 8 and 10 minutes. So I'm overwhelmed. Thank you so much, for being so generous. And I would just add to this that it's like my job, or any mentor that you choose, any course that you're choosing for your practice, their job is just to provide you with the material and fine tune you, but a lot has to be done from your side in order to practice and remember the right questions and follow the instructions that are being given. by your mentor, by your teacher. So whatever course you choose to go ahead with, just stick to that. Don't go with a lot of materials and don't overwhelm yourself. Take one thing, whatever course you are taking, take that course and study it completely. Practice it every day, and just memorize the things in a way that they come naturally, as Khala mentioned, and Zahra and Afira and Sana, all of them, they have mentioned, and all of my other students as well, that it should come naturally to you. So that is the key. So now, any questions or any confusions that the participants have, or they want to know, they can ask to any of the panelists, or I can also answer them. So any questions that you guys have.
Thank you so much, Dr. Sana, for taking this session. I want to ask, the course which you are starting on July 15th, is that a crash course?
No, the course that I'm starting on July 14th, that is the regular course. The crash course, I will be starting that in September. The exam is on 21st of September. So initially as well, crash course has just 8 classes. And in the crash course, we take 96 high yield, we do 96 high yield cases. They are from all over the course. But the regular course, it goes in a systematic manner. It is more organized because we go system wise in that. But crash course, it just has scenarios and explanations, because for the crash course, I feel that all of you are, by that time, whoever is attending the crash course, they are ready for the exam, so they should be able to tackle whatever comes. Okay, so the crash course is different, and the cases in regular course are different than the crash course. Like a few cases here and there have been repeated, but mostly the 96 cases which are in the crash, they are different than the regular course. And the mock has different cases. So if you're taking any of those, you get exposure to different cases. Yes, Aya, your question, please.
Thank you.
Sorry, I cannot hear you, Aya. If you can talk a bit louder. Still very you can try, yeah, start talking and we'll see. I
How
cannot
about
hear
now?
you. Yeah, it's better. Yeah.
Okay, yeah. So it was hard like to deal with the patient. Their answer was very long or very short, like or they were like super angry patient. How was it?
So, like, would any of the
Yeah, so
panelists like
I'll
to
I'll,
answer
I'll
them?
answer that.
Yeah.
So uh like I'll just give one example. So we did have a case of a patient with I think it was postpartum psychosis. So she was a little bit like jumpy, and she was having weird thoughts, and she was getting up from the chair again and again, and then she got a little upset, saying when I told her that she needs, like, we need to keep her and, like, help her and all that. So once she started, she was really angry. But once you start explaining to the patient, saying that, we had a scenario with Dr. Sana, so it was exactly the same. So she was angry, and then we tried to calm her down, and then she started getting calmed down. And I said, this help is for you. And she asked me if she was crazy. I said, you're not crazy. It happens because of hormones. When I started explaining her, so these patients are taught how to act. So when I started explaining her, she got really calmed down, and she sat and she agreed to whatever plan I was giving. So basically, what they're trying to see is that how you're able to calm down a patient who is upset, or who is having weird thoughts. So this was one kind of scenario. So Dr. Sana did, I did the whole course and the crash course with her. So I did both the courses. So she had a similar scenario where the patient was bipolar, and he was getting up from the chair. So they're just trying to see how you're able to tackle the patient. So patient wasn't angry. There was a patient who was upset as well. So you're trying to see what the patient's complaint is and trying to give them answers. So they're just looking at how you're behaving with the patient, and then the patients start cooperating once you see that, once they get the answers that are required. So you have to provide them with reassurance. And then once the patient is reassured, then they start cooperating with you. I hope that answers your question.
Yeah, thank you so much. And I really want
Yeah,
to
and I
know,
remember one of my student. Yes, sorry, Aya, you were saying something?
no, just go ahead. Just one more question.
Yeah, yeah, please go ahead.
Okay, and what one thing shocked you or
We,
you were surprised during the exam?
Aya, once again, we lost your voice. If you can talk a bit louder, please.
Now you can hear me more?
Yes, yes,
Yeah,
yes, that's better.
yeah. What one thing that shocked you during the exam, or you were surprised, or tell you like I should prepare that, but I didn't. I regret that I didn't prepare that. Just one thing.
Okay, so I don't know how to like answer this, but I'll answer in a nutshell is that like I like really I'm giving my very honest opinion is that Dr. Sana prepared us for the worst. So there was one station with I think I'm assuming it's pilot. I'm not sure whether it's pilot or not, with three handover cases. But Dr. Sana in her classes had given us a couple of similar scenarios where they were handover but were a single patient, but here there were three patients. So though we had practiced the one patient, so I was able to do it. Did shock me for a bit, but I was able to cope up with it. There was three patients. There was a handover from a doctor, and Dr. Sana had given us one scenario in her whole course, a couple of those scenarios where you have to take a handover. So, but Dr. Sana had taught us one, but there were three patients that we had to take a handover from the physician. I was a bit shocked, but at least I had a practice with one patient, so I knew how to take handover with three different patients. So I hope this answers your question. So there were three patients instead of one, but we were able, though I was shocked, I was able to answer it because I did practice that scenario with Dr. Sana.
Thank you so much.
Okay, so and I will just add on to that about the difficult patient that one of my students, she was in another station, not in Toronto, and when I was talking to her after the exam, she told me that her patient was actually about to leave the room, like she was so agitated, and then she had to calm her down. So SPs can behave a little bit different on all the stations, but their main script is the same. That you have to like they have to act like that, and you have to calm them down. Yes, Dr. Razia, your question, please.
Hello, thank you very much for arranging this session, Dr. Sana, the all your students. Um, I have question uh, uh, just the doctor told that you have to refer the patient for admission. I've my question is that this you have to accept the patient or you have to refer. I mean, can you explain it more?
So, Dr. Sana, I think this question is for you.
No, see, the patient was there with the, I think maybe you're talking about the psychosis patient. So you're supposed to tell her that you need admission and you have to say that, yeah, I will be giving you, like, there's a doctor who can help you further. You just have to mention those things. You don't have to go in depth with that, as Dr. Sana would have mentioned in so many classes, that you have to say the word that this is the right doctor for you, and we will be asking the doctor to come and check you. But your job is to make sure that the patient is safe and whoever is around the patient is safe. So you will say that I'll be admitting you, and there's another doctor who will be coming and seeing you, and he will help you further. And tell the patient what you mean by that, and just that's about it. Your job is to make sure that the patient is safe and the patient surrounding is safe.
You mean, Dr. Sana, we have to tell the patient, the psychiatrist or the suppose for upper GI bleeding gastroenterologist, what further management he will provide. We have to verbalize that.
No, you have to just verbalize that this is the management. Like, what are you gonna do for the patient? Explain him, because this is part of the management and diagnosis. Explain the patient. Let's suppose it's an upper GI bleeding, that this is happening with you, and this is why it's happening, or whatever the reason it is. And what are you gonna do for the patient? You're gonna admit the patient. You're gonna ask whoever you're referring to the patient. You explain to the patient that I'll be giving you a referral for gastroenterologist. He's gonna come and see you if you're admitting the patient, right?
Okay.
So you have to explain these things, and then uh, uh, explain what you're going to do for the patient there and then.
And I think that must be a counseling session, 11-minute session.
So if it's a counseling session, I think if you're taking Dr. Sana's classes, she will explain further. If it's a counseling session, again, you will explain everything, what the patient's condition is, how did what would it be the contributing factors or whatever it is. So Dr. Sana very nicely explain in slides. You're supposed to give acute management and long-term management as well. So whatever Dr. Sana explained, that's what I explained to the patient, and he was very happy. So the patient is going to give you prompts saying that yes, and ask the patient on every step, is there any questions or is there any concerns? What is concerning you? So that's very important question that you ask the patient, and if the patient has any concerns, he will tell you, and then you start addressing those concerns as well.
Okay. And while management, we should tell the patient that this is long term or this is short term. I think.
So I'm not sure if you're taking Dr. Sana's course or not. So if
I'm
you're taking
taking that course.
Yeah,
Yeah,
so
I'm
Dr.
taking.
Sana explains that you can divide it into two, acute management and chronic management. So with the acute and chronic management, let's suppose it's a thyroid case, you tell the patient that, this is the acute management, I'll start you on this medication, and these are the side effects, and this is how you're going to take the medication. And then with the chronic medication, with the chronic management, you tell them that you have to come with a follow-up as well. When should be the follow-up and how should be the follow-up? So that will help the patient understand and then go home. And then in the end, maybe you can say that, oh, I'm going to give you some brochures to look at
Mhm.
these, and you can understand that further. So with every class with Dr. Sana, what I gathered was acute and chronic management really helps the patient get you that extra brownie points. Like, that examiner is also knows that you know the knowledge, and the patient is gaining the knowledge out of you as well. Like in any case, when you go to a doctor, you have those questions, you just pretend like you are a patient listening to a patient and answering those questions, what questions you would have.
Yeah, okay, thank you so much. Yeah, I understand long term and short term. My question is that we have to do in the natural way. We are not telling that this is short term, this long term.
No,
Collectively,
we
we
just
have to.
naturally, you will naturally transit. If you act like a robot and you say everything like in, what you learn in class, it won't help. Your facial expressions are also very important there. Your body language is very important because the examiner is looking at you and the patient is looking at you. So very calmly tell the patient and try to be empathetic. Empathy, like long, like your empathetic voice and your empathetic gestures will lead you into getting high scores. So the reason I got high scores is that Dr. Sana taught us that with every patient, like, when you attend her class, if she'll tell you, give you good feedback, just listen to it very carefully, because that's going to help you. That really helped me. I don't know about others, but I'm telling you with my personal experience, that really helped me. So be empathetic towards the patient. So if the
Thank
patient
you
says,
so
I'm
much.
in pain, so say that, I know that you're in pain. Is there anything I can do for you, or what concerns you the most?
Yeah. And come up with your own natural style, like whatever your natural style is, as a physician, come up with that, so things will automatically fit into place. Yes, Dr. Fadi, your question, please.
Good afternoon, doctors. Thank you for this great session, and congratulations to the doctors for passing well in the OSCE. I would like just to ask for the physical examination, if it's like contain specific examinations like eye examination with white light or blue light. Also for interpretation, is there's any specific like audiograms, something like that? Um, and the other question, if we can know more about your course, it would be great. That's it, yeah.
Uh, I think you said that whether there's things to interpret
Yeah,
in the exam. Yeah, so we
no,
had
the,
X-rays, we had ECGs, and we had had CT report as well. So basically, when there were a couple of stations where it was outside, and whatever they're posted outside, they will post inside as well. So in case
yeah,
that you forget anything, so my approach, I had a high I'm not gonna mention exactly what score, a high 600 plus score. So it was around the second standard deviation. So how did I manage that? Is that I went in when I saw the X-ray and the ECG, I went in. With that, you can always like make it like a conversation between the patient. So you pick up there's an X-ray and the ECG. So I started explaining to the patient that what showed in the X-ray and what showed in the ECG. So the examiner was listening and so was the patient. You understand? So you'll have to interpret it. So there was an X-ray with pneumonia, like if you're attending Dr. Sana's class, you will understand she brings in X-rays as well. So when you start interpreting any X-ray, you start with saying what you see in the X-ray, how the exposure is, how good the X-ray is, what you see in the X-ray, then explain to the patient in like layman words. Don't use medical terminologies, don't use medical jargons, and
Okay.
that will score you points. If you are explaining to the patient is happy, ask him if he has any questions. And my patient did have a question that how did I get it? Then I explained him a little bit further and then he was happy with it. So he's going to tell you, okay, thank you, that answers my question. So these are
Okay.
standard patients. They know how to interact with the students as well. So they know when you tell them something that they want to hear, then they will give you an answer to it.
Okay. So this is means that I interpret, or at the same time I will like see what are the findings to the examiner.
Yes.
So it's
So
just
yeah,
like the physical examination. It's the
yeah. So
same.
when it comes to if it comes to physical exam, you're doing the examination. Please make sure that you're very gentle with the patient. You're asking him
Okay.
if he's comfortable, and then sanitize your hands, and then start with the examination. So whenever the examiner gives you a finding, be polite enough to say thank you for giving this finding, and then do the rest of the examination. Whenever he's giving a positive uh, feedback that this is a finding, like when you do in the class, I'm not sure if you're doing Dr. Sana's class. So when we were doing in class with her, when there was a positive finding, she would tell us, and then we will thank her and then start doing the rest of the exam. So
Okay.
there are a couple of things that you will catch when the examiner will say, oh, this is positive, this, and then he will say proceed. So thank him and then proceed. I mean, that's
Okay.
just like, the common courtesy, and then it will look like you are going through a flow.
Okay. Thank you. And
And you get in the exam, you can get lab interpretations, you can get X-rays, you can get ECG, you can get some common CTs as well, like subdural hematoma, etc. You can get that. So be prepared, and for like you should know how to interpret that, like a physician, and how to do it in 10 15 seconds. It should not take a lot of your time. Just 10 15 seconds to quickly go through that, give your findings, and then management according to that. Yes, please continue. You had some more questions, I think.
yes, it's just for the special examination for the eye examination and for like for interpretation of like audiograms. Some it's not X-rays, it's not CT, it's something common. No, something less common. Is this like an option will be in the exam, or we don't know exactly what we will face during that? Like, do we have like special tests? Yeah.
So generally, the things that you will get in exam, they will be from the normal things that you see in family medicine clinic. So you
Okay.
don't get, a lot of specialized tests or special tests in family medicine clinic. For example, if you're talking about an audiogram, so you might just get the findings. Like you don't have to interpret that. You will just get the findings in that case. But if it is iron deficiency anemia, microcytic anemia, a lab
Uh,
report showing microcytic anemia, and they have given you MCV and all those things. So you should be able to interpret that. Similarly, the liver enzymes. Liver enzymes can come in many forms. For example, in cases of hepatitis, they can come as alcoholic liver disease. In case of non-alcoholic fatty liver disease, so those are the common things you should know. But the very rare ones, no, it's not, because NAC is not, as I told you earlier as well, that it is not like QE1. It is different. It is not checking you on syndromes. It is not checking you on it is checking your skills as a physician, that how you communicate to the patient. Are you a safe doctor
I
or
see.
not? And yeah, so you just know the common X-rays, common ECGs, that we see on day-to-day basis,
Okay.
not the rare ones. So don't waste your
Okay.
time on that.
Thank you, doctor.
Yeah. Okay. Yes. FN. I don't know your name. Sorry, but your hand is raised.
Yeah, first of all, I would like to thank you, Dr. Sana, for that great session. And I just learned a lot of things in a very small time. And second of all, I just pay my greetings and congratulations to all your lucky students. These are the lucky people. And I wish for all of us to have a pass that with the great marks. And
Yes.
my question is that actually I'm very confused while interpretation case, and how would we have the case for the interpretation, and would we have the dialogues with the patient, or would we have the dialogue with the examiner? What will we face in the interpretation cases? We have to read the report like essay, or examiner will ask you the different question and the parameter, please.
So, like if you want to have a detail, look on how we deal with the case of interpretation, I have done a few free classes on my YouTube channel. I'll share the link with you here in the chat box. So, you can have. So we have done, liver enzyme interpretation and this um, um, urinary incontinence counseling, and this was one, the microcytic anemia lab report interpretation. I have done those videos on YouTube, so you can have a look at that. That how we go ahead with that. But usually, how it comes in the exam is that usually the lab report is given outside on the door, or if it is a part of post encounter, then in the post encounter, when you say that I will be doing this exam for the patient, so they will give you the report. Okay, you did that, here is the report, now give your findings. So it can come in both ways. If you get it outside the room, it will be more like a counseling station. Most probably that the report is there on the door and you have the scenario, you have to read it. Then you go inside, the report is available inside as well. So if you have not, taken a look at the report outside the room, just go inside the room and tell the patient that I'll just take a minute, I'll go through this report and then we can start discussing. Then take some history, ask the patient that is it okay if I ask you some questions before we go and discuss your report. And then there is a pattern that we follow for lab interpretation. There are some W questions that I teach my students at how to proceed with that. So anyways, proceed with that pattern, then give the lab interpretation and then counsel. So this is one way. The other way can be that you have to take history that they give you, that the patient presents to you with, for example, abdominal pain. You start taking the history and you come to the diagnosis of probably a UTI or a nephrolithiasis, something that you're thinking. And then you ask the patient that examiner asks you, okay, what investigations will you do in this case? So if you say it that I will be doing a urine complete and culture, then the examiner will hand over you the report and say, okay, you did the test, here's the lab, now give your working diagnosis and the treatment. So you go through the report and you see it and you give your interpretation. If you will not say that particular investigation for that case, they might not even give it to you. So, if, for example, if it's a case of chest pain and you say that I will be performing an ECG for the patient, the examiner will hand over an ECG to you and say, okay, here's the ECG, you did the ECG, this is the ECG, please interpret this for me. So, this is how the lab interpretation can show up in the exam.
Okay, Dr. Sana, that was very well explained, and thank you very much. And my second question is that I'm also very confused while time management during the when we have the task to do a focus history and the focused examination, because I was very confused between the detailed history and the focused history, detailed examination and the focus examination. Yeah.
So, if any one of the panelists would like to answer that, they can go ahead. Otherwise, I will I will pitch in. So,
I'll
I think
answer it.
Zahra has left.
Oh, Khalu.
Yeah,
Oh, okay. Go ahead.
no, that's fine. If yeah, I think Zahra has left. But if Hala wants to answer, or Sana, any one of you can answer that question, and then I'll
Uh,
just pitch in.
yes, Dr. Sana, if you want to go ahead, you can go.
No, no, please.
For
So
me, like
you are recent candidates. Please go ahead.
just a minute. Uh, so, in my experience, the focus history is the one you get. You have to be very much particular. Like if for example, if there is a case of thyroid, but you have to be and you have to examine. Then you have to first of all take the presenting complaint and rule out certain Sorry, I have a lot of
No
interruptions.
worries. No worries.
Yes, so you have to rule out all the important differential diagnosis in very few questions to reach the diagnosis, and then perform. You have initially 5 to 6 minutes are enough, like 4 minutes, 4 to 5 minutes. I'm sorry, Dr. Sana. Please,
So
somebody else.
Sana, you can take over
Okay,
to
so
answer
I'll
that
I'll
question.
answer that. So let's suppose you have focus physical and examinations, and so before you go to the door, once you go to the door, there are 2 minutes outside, then the bell rings, then you go inside, right? And then after the 8 minutes, before the 3 minutes, there's a bell again. So I would say 4 minutes for the focused history and 4 minutes for the exam. So just ask questions related. Let's suppose once you start asking the patient questions, you will understand. Let's suppose, like Dr. Khala mentioned, that it's if it was a thyroid case, you start asking when did the pain start, what did you notice? Let's suppose the patient said that there's swelling in the neck. So ask a couple of questions, and always Dr. Sana will say something to us is that try to ask 1 or 2 questions from the systems above and below. So just rule out couple of things and then move on. I mean, you don't need to ask so many questions. Let's suppose it's a thyroid case, don't ask questions about the legs. So what would be the another system that would be very close by is the chest and above the head. So just ask couple of questions, rule out a couple of things so that the examiner knows you're trying to rule out a couple of differential if you get the diagnosis right. And then move on to the physical exam. Do a full focus exam for 4 minutes. And then the bell will ring and the examiner will ask you questions. So try to make sure that you're asking questions only related to the system that you think is involved and one system above and below. So that should be more than enough. Just ask focus questions, any difficulty swallowing, any chest pain, any palpitations. So that will cover a couple
Exactly.
of questions, and always ask those red flag questions like any weight loss, any headaches,
Yeah.
any bony joint pains. So that's going to help you get the diagnosis right.
Okay, so means we are just asking the important question, the related question, and just rule out the red flags and are the differential questions in focus.
Yes, always rule out the red flags, as Dr. Sana always says, rule out the red flags because sometimes you get a station where maybe this is a query something else. So red flag questions, we had a station of fatigue and the diagnoses were differential were so many. But if you follow the systems like one above and one below, you will always catch would be you asking the patient to swallow, you checking for the lymph nodes, you checking for the heart sounds and for the bruit as well. That would be very important. So
Mhm.
always do those kind of steps that are very focused to that exam, like thyroid, and then do a couple which you think are important related to the thyroid, like checking for tremors. You understand? So if you're in a doubt that maybe this is going to help you with the diagnosis, then always say that I would also like to do that. And the examiner would say proceed, normal proceed, or the examiner would let you do it. So, I mean, it's always like whatever you are in doubt, please try to do it.
Okay, so that means we have to show that we are want to do this, but because of the time, examiner will stop us.
Yes,
Yeah, for
examiners
focus.
are nice enough to stop you.
Okay, thank you
Yeah.
very much. Very well explained. Thank you.
Yeah, it's focused examination. Whenever it says focused examination, always go with the system that will give you maximum findings. Then go to the next system. Don't start with periphery because, for example, if a patient is coming to you with some heart condition or abdominal pain, and you're suspecting that the patient might have liver disease, so go for the system that will give you maximum findings. So ask yourself this question: that will a GI examination give me a quick list of findings, or going to the periphery? So start with the system that gives you most of the findings, then go with the next system. And always remember that whenever you are examining heart and lungs, they go hand in hand. So do the rest. If you're doing a respiratory examination, go with CVS examination. And in both the systems, never forget the leg examination, just to rule out any DVT, PE, etc. So these are the things that keep in mind. So focus examination means that you just have to focus on that system. In neuro, especially, focus examination is more tricky when it comes to neurostations specifically. So you should know which nerves you have to examine. You don't have to do the entire cranial nerve examination. And in the end, just mention that I would like to complete my examination by performing Romberg's test, or going for reflexes, or whatever, whatever your plan is according to that. Yes, Dr. Eid, your question, please.
Oh, yeah. Good afternoon, Dr. Sana.
Good
You have been
afternoon.
mentioned that the evaluation have three domains, right? Assessment and diagnosis is taking about 70% of these
Yeah.
domains. So my question is, the course will be more concerned on focusing on the assessment also as well, and
Oh, yeah.
if we will have some like physical examination of this course. My second question,
Yes,
please.
so my students can give you a better answer to this, that how relevant the course was with the exam structure, but the course has everything. My course has almost 150 to 160 cases that we do together, and they have physical exams. Of course, you have to practice them by yourself because it's an online course, but I do give the entire template, that how will you be talking about it, how instructions will be given, so you can memorize that and then you can reproduce that. And Sana or Khala, any one of you can answer that, how relevant this course was with the exam structure, considering assessment diagnosis, which holds 70% of our exam.
Again, this is not a paid review. I'm just telling everybody because, like, I'm telling you, when I finished the exam, the first person I thanked was Dr. Sana. And I have a reason for doing that, is because her course was very structured. So in that course, we did learn, like, whenever you see the prompts, whenever we used to see her slides, it had everything on it. Like, you didn't have to go back to books, search for a particular thing, and then come back and then incorporate it into slides. I've never done that with Dr. Sana's slides. I've only taken her course. She was the first person I approached and the first course I took. So she goes very systematically, and that's going to help you in the exam, because when I was going through her courses and when I did the lectures again and again and try to figure out where I'm lacking, it has everything. When it starts from introducing to the patient, thanking the patient, going towards the physical exam, what physical exam is focused, all her slides has everything, so you don't have to go refer to other books, because the time is very less, because you're appearing in September and we are in the end of June. So let's just say we are July, August is left, and September you will be rushing through just revision. So what I would suggest is go through the slides again and again. It has everything from physical exam of how to greet the patient, how to thank the patient, what management to put to the patient. So that helped us, because that trains your brain. When once you go there, it will come in a flow. Even if you're not looking to because there's a booklet they give you. I did write on it before going to the station, but I never looked at it. As I think Dr. Khaler or someone mentioned, this is because the time is very short. Once you go in, it's all what you have in your head is going to come out. So if you've gone through the steps of her slides, it's going to help you immensely. It's not a paid review. I'm just telling you, it was what she taught, exactly what I performed. So I'm telling you, once you start practicing and once you start looking at the slides, going from saying hi to the patient, thanking the patient, going to the physical exam, how to manage the patient, it's all written there. It's all very useful.
Yeah, thank you
Yes,
so
I
much.
would like to second Dr. Sana here. What Dr. Sana Umar has told us, it really helped us a lot in the exam. And it was very
Carry
systematic,
utho.
especially the slides she provides. They are very systematic up to the point, like what points you must not forget while giving the answers in the exam, what questions you must ask, what red flag you must not forget, that are very important from the exam point of view. And again, I would second Dr. Sana Haris that it's not a paid review. We are giving our authentic, and Dr. Sana hasn't asked us to tell this. Like it's coming from the heart that what the course she has provided us, it really helped us a lot. Like I wasn't expecting my score to be that high. All thanks to Almighty. After that, it's Dr. Sana Umar. Thank you once again.
Thank you so much.
Yeah.
You guys have been very kind, because today's agenda was just to share exam tips and tricks, but you have been very generous. So I'm grateful for that. But yes, I will just add to that, that when I designed my course, I focused on the areas where I struggled when I took some courses for my exam. So I used to go back to books and study for post encounter. I used to go to another book for physical exam, to another book for counseling, and it was so hard for me to compile everything because they provide you, like I was provided, I didn't just take one course. I took multiple courses because my exam was delayed a lot of times because of COVID. So I got almost 10 months during that time. So in those 10 months I attended one of private colleges here in Alberta. I studied with them, in fact two institutes. I studied with them, then I studied another course. So what I found difficult was that I had to go through so many books when I was preparing for the exam, for something for post encounter, something for something else for extra interpretation, something else for ECG. So I compiled everything in the course so that my students don't have to open multiple books and go through them. So I made I tried my best that I do the hard work of compiling the notes and you guys do the hard work of memorizing and just taking that one thing. You don't have to take any extra post encounter courses or anything for that, because I do provide with post encounter, I do provide with focused examinations and general examinations, and for counseling I give scripts to my students. So this was not part of today's agenda, but just it came up, so I'm mentioning it because the counselings I give it in the form of a script. Like you have a script for the drama and you have to memorize and prepare that. This is how it works. So yes, Dr. Razia, your question, please. We cannot hear you, Dr. Razia. I can see your question in the chat, that how many stations were with physical exams. So again, because as far as I know, there were two stations, but the recent exam takers can comment more on that. So Sana and Khala, how many stations both of you had on your respective stations when you went for the exam? How many physical exam stations, I mean?
I think, Dr. Sana, there were just two. But the thing is that for every exam, I think it's different. I'm not sure, but I've heard that for every exam it's different. For us, we only had two stations with physical exam. No, three stations with physical exam. So, I mean, there was counseling as well, the handovers as well. So with every station, with every exam, I think it's different. For us, there was three physical exam, as I can recall.
Thank you very much, Dr. Sana. Both of you, both Sanas. Uh, I want to know that all physical examination were with history. I mean, no one, no station has only for the physical examination.
No. There was no
Yeah.
one station with only physical. There was counseling, physical with history.
Yeah.
Okay, thank you so much.
Yeah, it's very unlikely that you'll get only a physical examination station. Very, very unlikely, unless it's like your very bad day. Or so you can get a cranial nerve examination station only. That is the only thing that can come as a complete, physical, which but it is very rare, very rarely heard of. So usually it's a combination station. You can have history and counseling, or you can have history and physical, or you can have all of three together. Hala, would you like to add to this? Were you at the same station or another station, and how many physical exam stations did you have?
Yes, Dr. Sana, I was as I have mentioned, I was also in the Toronto station and I have the same exam stations. And it was with history and physical examination, no only physical examination station.
Yeah, and in my exam, I remember I had six counseling stations. So I've seen this trend over the years that, they're introducing more and more counseling stations, because I feel that that is something that we lack at as IMGs. So in my exam, I had almost four to six counseling stations. Some were complete counselings and some were like lab interpretations, etc. And this is how the pattern usually is. So physical is there, you will get, and usually the physical exams which you are being tested on, they are the ones which are easy for you to do and easy for the SP also to cooperate. So your main systems, respirology, CVS, abdominal examination, thyroid, in MSK, shoulder, ankle, those things which are easy to do, knee examination. These are some of the, or for example, in vertigo cases, you can get to the physical exam of BPPV and all those things. So those are some of the things that they can test you on. Okay, any more questions? So no more questions.
Thank you so much. And the physical examination, just we have just in the notes, or that much is enough. Don't need to do anything in detail.
Yes, the one that is in the notes, that is more than enough for you if you are prepared, and along with that, just supplement it with your own practice. There are so many YouTube channels, and I've shared some with you guys as well in the course for CNS examination, especially. There is one YouTube channel from a professor of University of Alberta. So I really like his physical exam when it comes to neurostations. But there are many YouTube channels that you can, just supplement, just go follow the procedure with them if you cannot go out of the house or don't have someone somewhere where you can go and practice. So just practice those examinations again and again, and revise that with the notes, because in the exam you have to verbalize it as well, and you have to do it as well. So you have to tell the examiner that I'm palpating looking for this, I'm inspecting the abdomen looking for this. So then the examiner will give you the finding, and if the finding is not there, they will just say it's normal, please proceed. So you have to tell why are you doing that particular examination. You're auscultating the chest, looking for what? Vesicular breathing, bronchial breathing, or any crackles, basilar crackles, or what are you looking for? So you have to tell that what are you looking for. And usually in the physical exam, if you do, especially in MSK, if you don't know how to verbalize it, even if you give instructions by doing it, the patient can do it. For example, you can tell the patient that, can you touch your, if you're checking for median, or you can say, can you, make a pinch like this, or um, do like this, fan your hands. So you can always do that as well. Okay. Any other questions? Okay, no more questions. All right. So thank you everyone for joining us. Thank you very much to all four panelists who are here. I will try to do a similar session once again a bit near the exam. If you guys have any questions, those who are preparing for the exam. So yeah, if you're struggling with any topics, you can just write on my main Medicine by Heart chat group. So usually I do free classes as well. For example, in my last session, some students mentioned they were struggling with gender dysphoria. So I did a case of gender dysphoria. So everything is there on my YouTube channel, and I have attached the links here. So thank you very much. And you can also reach me out at medicinebyheart@gmail.com for any queries. So thank you, Sana, Khala, Zahra has left, and Afira has left. Thank you, everyone, and enjoy the rest of your weekend, and best of luck to everyone else. I will just stop sharing it now.